We hate the 5-star thing. We are not a hotel.
1 star to 5 stars is how the federal government ranks nursing homes and long-term care facilities to help consumers choose where a loved one is going to live next. So now the Centers for Medicare and Medicaid Services is adding extra information about staffing levels to the STAR system. So 3 on your side, Susan Campbell is here to break down what this all means. Hey, Susan.
Good morning. Yeah, we're talking about turnover and weekend staffing levels. CMS says this is a really important thing for consumers because staffing is a huge part of the quality of care. A group representing nursing homes here in Arizona agrees staffing is important, but they say right now in the middle of a staffing crisis, that new information may not tell the whole story. Across the state, nursing homes and long-term care facilities are facing staffing shortages.
We hope it gets better. We don't see it getting better this year.
Dave Vopel is the CEO of the Arizona Healthcare Association, representing long-term care facilities across the state.
Although we were the first to be in this staffing crisis, we'll be one of the last to get out of it.
Now consumers will be able to easily know exactly what's going on with staffing. The federal government's Care Compare website now includes staff turnover rates as well as weekend staffing levels. CMS Administrator Chiquita Brooks-LaSure says staffing is a vital component of a nursing home's ability to provide quality care.
It's certainly indicative of the culture of the place. Outside of COVID, you have COVID in there and all bets are off.
Do families have the right to know what's going on with the staffing?
Completely have the right to know. We're all about transparency. We want facilities to be totally transparent. The problem is that we think they're a little tone deaf on this because we're going through a pandemic and we have a staffing crisis. So it's not going to look good no matter what you see on there because we're depleted in staff.
A better indicator of what's going on at a facility, according to Dave, is an in-person visit. If you're considering the place for yourself or a loved one, schedule an appointment with the administrator and come armed with questions.
I want to find out what specifically are your specialties. Do you have any specialties? I want to know what's the average age of somebody in your facility. If it doesn't feel right, don't put your loved one in there.
We have a link to the Care Compare website right now on our website, azfamily.com. Scott, besides staffing, the rankings also include things like health inspection reports and some other touch points. So there's a lot of good information there that can give you at least a starting point.
Yeah, that stuff is all important too.
Absolutely.
Really important. Susan, thank you.